Betsy McDaniel in for Jessa Jeremiah today, and we are here with Dr. Mathew Epps at his beautiful office here in Bluffton. And we're going to talk a little bit today about what makes you guys unique, because you see all along 278 Med Spa, come here, we've got fillers, we do this. I mean, even maybe your general practitioner will say, hey, we can give you some fillers, but what makes you really different and why people should come here to see you? And I know some of it has to do with what's on this wall here.
So we are a unique practice in that we build strong relationships. We have a boutique style format. Our time with our patients usually first is just to get to know you, what your goals are, your experiences so far with medical spa treatments. It's been kind of the Wild West around here for years. Yeah. And so to come in and try to establish a new routine and a new option for folks who may have had have a great experience before but want to take it to another level. So we innovate, we build in certain technologies in the practice that allow us to take it to that level. Right. One of which I'm going to introduce you today, and I think it's really important right now with everything in the economy. People are just sort of, things are tightening up, and so you want for your dollar a little bit more out of it. You want to make sure that you don't have to redo fillers or redo Botox or redo surgeries. So today we're going to introduce
particularly surgery. I mean, that's a big one to have to redo.
Surgery. Yes. And that's one of the things is that I'm unique in the areas and one of the only oculoplastics trained and facial plastics trained plastic surgeons who's here. And that's a science in itself. It's as I've spoken before, it's a really precise surgery. That needs to be taken very seriously, and you spend time with folks and you need to explain them all the benefits of it, but also the risks of it too, and how our techniques are designed to make that the safest and the best outcomes. But today we're going to introduce you to a simulation system that we use that allows a patient to see before and afters of what our goals are, and also to identify anything that they may want to enhance or change or correct from previous experiences.
Well, I'm excited for that. Can't wait to do it. So here is the technology we promised you. It is 3D imaging, and you can do so many things with this. Tell us about it.
Well, we start with, if it's for a facial surgery, facial consults, it's very nice, especially in the med spa, but also with facial enhancement, facelifts, volumization, is that we can simulate in 3D a patient's face, and it's an image that they can actually take home with them. And if I can show you a little bit of how it works. Here I've taken our model Jane, and she's actually, we'll present this up on the screen for the patient as they're sitting and getting an exam, is that I've gone ahead and simulated what resurfacing with 3 series of erbium laser would look like, and about 6.6 cc's of filler just laterally in her cheek compared to how she looked before.
That's amazing. I mean, it really is amazing. And it's such a subtle difference, but it makes a big difference.
And you can see what it allows is the patient has more control of what they want, and they get an idea of what they're getting before basically spending the money. And that's the whole point, is more value. That's the way that practices should be moving towards. Yes. And that's definitely the way that we have already moved towards.
Absolutely. That's amazing. What else can you do?
So what's phenomenal, as far as surgeries, we can simulate a lift, we can simulate a rhinoplasty or a chin implant. Right up here on the top, you can see this. So these take a little bit of time to do. They have measurements that I have to place into them, but I can essentially create very close to what the final surgical result would be of, let's say, a nose. And so we can take a dorsal hump down, or we can take cartilage here that's large or a bulbous tip. And we can also project, simulate the projection of a chin implant. With most people, they're harmonious, whereas the lower chin matches where the forehead is. There's a line that runs here. Some people have a recessed chin, and they look just markedly better with simply augmenting the chin, whereas they'll come in and they'll look like they have a prominent nose, but actually it's the chin, and you can disguise any prominent nose by augmentation of a chin.
Oh, that's interesting.
It is.
Who knew? I mean, you knew, but I didn't know. How would anyone ever say no to you after you show them these pictures? That's what I'd like to know.
What's wonderful is they can go home. Our practice is designed, we're really patient oriented, and one of the things on top of our EHR, electronic medical records, is that you can actually take these pictures home with you and look at them on the couch. And one of the most wonderful things is most people don't see the side profile of their face.
Right.
This is really important also in breast surgery, body surgeries. you really want to get an idea of what you look like from the side, and especially if you're picking breast implants or reduction or lift.
Well, so I think next time we come back, we're going to move from the face and maybe show some of those body things, because this is fascinating. Thank you for sharing it with us.